Good morning and welcome to the WellMed Charitable Foundation Caregiver Teleconnection session today, presented by our expert speakers, Lucy Barylak, MSW, and Elliot Sklar. I'm going to tell you a little bit about these folks. Dr. Elliot Montgomery Sklar is a public health professional with 2 decades of experience in supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually. And his research is focused on the complexity of issues related to aging and caregiving. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally. And as it relates to our program, he is giving 2 presentations this month at the American Society on Aging meeting about our caregiver teleconnection program. He's also recently published research in the American Journal of Occupational Therapy, the Journal of Applied Gerontology, and the Journal of Social Services Research on themes related to our series this month, even though this is the end of the series today. Now, Lucy Barylak has a master's degree in social work from McGill University. She is presently working as a consultant for a health network in Montreal, Canada. She's been involved in various research projects and has published numerous articles related to caregiving issues. She's lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and their clinics in Texas. And in addition, Lucy would like you to know that she was the caregiver for her mom for about 10 years. And with that, Lucy and Elliot, please start your presentation.
Thank you, Evelyn. Good morning, everyone, and welcome. As Evelyn said, I still have a bit of a cough, so you'll have to excuse me from time to time. What I want to talk to you about today is extended caregiving can bring on tension within family dynamics and added stress. And this has been the case for many people before and during this pandemic. Caregiving can be a very rewarding experience, but also very challenging. When you couple that challenge with this enduring global pandemic, many of us has been through a lot of stress in the last 2 years. We have received a lot of questions from children caring for their parents and about conflicts that have come up because people aren't able to share responsibilities the way they might have before the COVID. So despite the challenges of the past year, it's a good time to reassess the kind of sharing of care that children mainly ideally want to have when providing care for their parents. It's a good time to use for us to kind of look at what is family dynamics and how to work through difficult issues with family members. So I want to kind of talk a little bit.
In progress.
What's going on? Is everything okay?
I hear you fine, Lucy.
All right. So let's start by understanding what are family dynamics. It's how each one of us interacts between our family members and how we communicate and make decisions that benefit our family. That influences family structure, hierarchy, the roles we play, our values, and behavior. Family dynamics has a strong impact on the way children and adults see themselves, others, and the world. We each have a role in the family that makes up the cultural, structural, the good, the bad, and sometimes even the ugly. Family dynamics determines how the family functions as a unit, how to solve problems and share feelings. A family dynamic shows the type of interaction and the level of communication we have within our families. And I think each and every one of us, if you can take a bit of an opportunity right now, because we're talking about family dynamics, where do you fit in within your family? And one of the most important things is to think of, how does this family communicate? Does it have secrets? Are you open? You know, do you talk behind each other's backs? How do you communicate? Because really, there are always difficulties and important questions when it comes to caring for our loved ones, especially if it's within the family. How we care for your loved ones at home. Who will look after them? How will expenses be paid? Watching the strengths and dependency of decline in someone you love is difficult for everyone to witness. When you combine the emotion, the stress, the predisposition of a whole family, it is understandable that tension may arise. I guarantee you, in each family, it does happen. Now, going back again, communication is key when choosing which family member will be responsible for what kind of care, support, and help with the tasks. For example, who lives closest, who has the most free time outside of their daily responsibilities. And it's important to revisit these things periodically, not to just assume that just because somebody's been doing this for a long time, they might be, getting tired. And if you don't have good communication skills within the family, it could be quite disastrous. So I think this is what we want to focus on today. And we receive quite a lot of questions from family members. And we hope by answering those questions for them today will be helpful for all of you.
Well said. I think our series this month has really focused upon a lot of hot topic issues related to aging and caregiving that have changed because of our experience of the pandemic. Some of you might feel like you've changed because of the pandemic, or people you know have changed because of the pandemic. Certainly, many people's view of long-term care declined because of the experience of the pandemic. And in our current environment of high inflation and high costs of living, this has impacted caregiving and aging. We've talked about home modifications during this month's series and budgeting for long-term care, but the cold hard fact is that most people can't afford long-term care, or they feel uncomfortable with placement or haven't planned. Any of these things can have a domino effect and will affect everyone around the person for whom care is being provided. Many people are making decisions because of what they can and cannot afford. And sometimes that has been leading recently to cohabitation or living with family and friends. So over the course of the pandemic, caregivers and healthcare professionals have reached out to share their experiences. Some have faced challenges when caring for loved ones at home, and we're seeing more intergenerational families living together. That has caused some tensions, but also some realizations for people. For example, some caregivers have been witnessed much more closely to a decline in their health of a loved one and don't know how to handle certain difficult behaviors or issues at home. I want everyone today to remember that when we provide care to others, we're all in a stressful time. And with an ongoing pandemic, we also need to care for ourselves. That's tough. And when our loved ones who might suffer from dementia or even something like chronic pain seem more agitated or irritable to us, it's a symptom of what they are feeling too. We have to keep that in mind. It's not personal, which is a very hard thing, I think, for people and caregivers to internalize, especially because caregiving is so very personal. Now, the pandemic's toll on older adults, especially those living in nursing homes and other long-term care facilities, has brought about the issue of living independently at home into the national spotlight. So have policy proposals around the changing ability of Medicare and Medicaid to pay for virtual care and also in-home care if needed. There's new data from the National Poll on Healthy Aging, and this was just published last month, suggesting that people in their 50s, 60s, and 70s need to do more to modify their homes or plan for services they may need if they want to avoid or delay needing to move. The poll also showed a lot of differences in aging in place readiness among the 28% of older adults who told the poll that they live alone. In all, 88% of people between the ages of 50 and 80 who were polled said it was very or somewhat important that they live in their home as long as possible. I'm sure many people participating today certainly feel the same. Only 15% said that they'd given a lot of consideration on how their home might need to be modified as they age, and 47% of people had given it little or no thought. Meanwhile, 48% of those who live alone said they don't have anyone in their lives who could help them with personal care, such as bathing and dressing if needed, compared with 27% of people who live with others. That's significant. And as for hiring help, only 19% of older adults said that they were very confident they could afford to pay someone to help with household chores, grocery shopping, personal care, or even managing their finances. On the other hand, about 2/3 said that they called their current physical or mental health status fair to poor, and they were not confident or not very confident that they could afford help. So that's really why we're here and why we're talking today. It's really important to take steps to understand what's available in our local communities, also through the National Elder Care Locator, your local area agencies on aging, nonprofit organizations that may be serving your community. These are all different sources of support that could be provided to help get people more prepared. A good example of that here in South Florida, Miami-Dade County has had a nonprofit organization that received a grant to assess people's homes for aging readiness and to install grab bars and things like this free of charge if they meet certain criteria. There might be similar programs in your community. So I think it's important that family members help encourage one another, certainly older adults, to see what's out there, to invest in home improvements, to aid them in installing safety devices, and also technologies that we've talked about before that can help support aging in place, like asking Siri to dispatch help if you need it, or Alexa. There's also AARP research that consistently shows that the majority of older adults want to stay in their homes and in their communities as long as they can. Most of these houses, though, weren't built to support the needs of people aging through many stages of life. So the best way to continue living in the home that you love is to plan ahead and to make changes that will accommodate your needs in the future. That is where all these resources come in, which we'll be sharing after our program today. And I was just curious to take a pulse sort of our participants today. How are you feeling? Are you living somewhere where you hope that you can continue to age in place?
For those of you on the phone, you can press *6 to open up your line. If you're zooming in, you can press unmute. We would love to hear from you. As I said before, it always makes our presentation so much richer when you tell us what it is that you need or what you've done. We would really love to hear from you.
I would like to live in my home as long as I'm able to physically. I'm sure many people participating have the same sentiment.
You know, so
yes, I live up 2 sets of stairs. So I'm making sure that I do lots of exercise, lots of walking, and I'm back in PT to get my back, straightened out.
Good.
You know, I was just thinking about that the other day. I would like to stay where I am as well. One of the things we always tell people is not to have mats or carpets lying around. And all of a sudden I took a look and I said, you know what, Lucy, you better start planning a little bit better. Like right now I'm okay. But it's just interesting that it's so important to plan ahead or to think about things so that you don't fall or hurt yourself and you can continue living.
Sandy, did you want to say something to us? Please go ahead.
Sure. My husband and I, about 8 years ago, because of bad knees, before we had our knee replacements, moved to a ranch townhouse to downsize and to have less maintenance. And then since my husband's strokes, we've had to put in grab bars and do all the power lift chair and hospital beds and all those things for his issues. So I'm comfortable in a place for us to continue to live, but I'm also open to needing to downsize again, if that's
Right.
something.
Mhm.
That makes a lot of sense. And I think we're seeing that reflected in many parts of the country. There are a lot of communities that are popping up that are transitional. They're senior communities, but they support independent living, and they have care and staff on site to help transition you to full care if you need it in the home or in another building within the community. I think it's a great model because when you feel comfortable in a community in which you're living, most people want to stay there.
Mhm.
We have another comment from Tawny. My mom would like to age in place, but she's to the point of needing to have an alert person with her at all times. And my schedule just doesn't allow for that.
That's
Yeah,
tough.
that
Go
is,
ahead, Lucy.
no, I'm saying that is tough. And I think the fact that you're listening to us today gives me the sense that it's important for you to look for resources to help you make the decisions with your mother if she's competent enough to make those decisions.
We also had another comment from Ella indicating that she would like to stay in her home as long as possible. Our home was built with us aging in mind, which is wonderful.
That's great. Okay, so, as Elliot was saying, we do receive a lot of questions, and this one kind of hit on the spot because I think, remember when I was talking about the whole idea of communicating with your family? And this is how the question goes. I've been providing care for my parents over the past 2 years, and we've been dealing with COVID. My parents live independently, but don't drive. We don't live terribly far apart, and my brother and his family also lives nearby. Until we were all vaccinated, we agreed that I would be the primary caregiver to my parents because I have older children who live away, and I work from home. My brother is a grocery store manager, and we were concerned about his level of exposure with the public. We've all been vaccinated for over a year now, but my brother has not mentioned anything about us going back to sharing responsibilities. I'm burned out. It's starting to really upset me, and I'm growing resentful. How do I address this? So that leads me to believe that I'm wondering about their communication. But first, I want to say thank you for your question. There's always one family member that steps up and becomes the primary caregiver for a parent, and that seems to be you at this time. I can certainly understand that you're upset and resentful and probably angry as well. It's important, first of all, for you to acknowledge your feelings, and you are, and not to keep them inside of you. Otherwise, they will fester and they will only get escalate. So it's really important to address the problem head on. The first thing is to be honest with yourself and identify why you're so angry. I can understand, but I'm just wondering why you're so angry with your brother and you can't speak to him. Accepting that anger is simply a way of expressing hurt, fear, and frustration that may be from the past and dealing with your brother. You need to let the past go if that's the case. It's important, as I was saying, family dynamics. First, understand, why am I angry? Why could I not just call him? So obviously, there might be some underlying issues there that you need to really think about. So you need to let your brother know how you feel. That's very important. You need to do it in a very calm and not in an angry way. Okay, you have to prepare yourself. Otherwise, he will become very defensive and the communication will shut down. Tell him that you need his help in order to support and care for your parents at this time. You've been carrying it for a long time. But what's also important is prior to the meeting, identify all the caregiving roles that need to be done. Let him know which ones you are able to and willing to do. Ask him what task he is able to take on. And if need be, you need to negotiate with him. Now, I know we have a slide also that has all the tasks, and if Elliot can just put it on the screen. I mean, it's a wonderful checklist that if you do want to have a talk with your siblings about tasks, they're all there, okay? And I want to, negotiation is very important, and remind him, you're not doing this for yourselves. You're doing it for your parents. Focus on what they want and pick your battles carefully, you know? Try to stay calm and reassured. And most important of all, try to stay friends with your brothers and your sisters or your cousins, whoever is helping with this task. You know, they are family after all. So that's part of good communication. So if you have a hard time speaking to your brother, there must be a reason behind that in the family dynamics. So really asking him to sit down, a cup of coffee, quietly, having your list ahead of time, letting him know that you appreciate all that his work, but that you need help, identify the things that you can accomplish, and ask if you can negotiate with him to help with the other tasks. So I want to wish you all the best. Now, I was wondering, are there any other thoughts on that? Maybe Elliot or Evelyn or our
Well,
participant?
we have a couple of chats that came in that I think are pretty relevant.
Sure.
From Kim, my husband and I are 64 and 66, are in great shape for now. I'm tuning in today to see if there's anything I can do to help my mom who has Alzheimer's. She is 85 and I am having trouble finding the end of that. She's 85 years old and needs to think of her needs. And that's it. She needs to think of her needs.
Well, I guess that she's concerned about her mother. I'm not sure if the mother is living alone or not, and is her mother competent to make decisions for herself? Does she want any help?
I think a very important thing is also getting in touch with your local area agency on aging to see what support services are available, including social work support to help sometimes navigating these difficult discussions.
For sure.
If you don't mind me adding something, there are geriatric case managers who also can come in, actually do an assessment of the whole situation, of the money, of the family dynamics, of what the potential places are. We're getting a lot of questions on chat, both about monitoring equipment and about how to talk to your parent. And Lucy, you do such a nice job of really putting it out there and just being honest and open and not being angry. Angry only, takes your energy. It doesn't do anything to the other person. A lot of times they don't even know it. So I think, Elliot, that you're really right, to get some resources in there, to get some professionals who've dealt with this before is so important.
I think it's very important to be able to assess, you use that word, to be able to assess what are the needs. And again, to really have a good understanding if the person is competent and able to make decisions for themselves, we have to look at, are they putting themselves at risk? So good assessment is something that is very important to start off with. I just want to tell you something on a personal level. When I was caring for my mother, she didn't want to have home help, but I was working, had my own family, the young kids at the time. And basically what I said to her is, don't do it for yourself, do it for me. Because if you do it for me, I can then go to work, I'll still be around. And somehow it worked for us. I know it's not for everybody, but if you approach it with that way, a lot of caregivers say that they say it really does work. Just a little bit.
Lucy, I think that is such an excellent tip, and I was going to say the same thing. There was a point in time when my mom needed help at home as well, and she was very, very resistant. And I said the same thing. I live far away. I can't help you myself. Please do this for me. And I think everyone knows the dynamic in their family and the woo that we call it that would best help persuade your loved one to be perhaps a little bit more open to things. As you said, Evelyn, we received a lot of messages in the chat box, so can I go through them?
Please.
My mom lives alone, and this is from Adele, and I'm constantly monitoring her. We don't live together. She owns her own home, and we really aren't suited to live together. How can I broach the subject of safety with my mom?
Well, it goes back to the communication, the family dynamics. It all depends what kind of a relationship you had with your mom to begin with, something that you were able to share with her or not. But I think that being honest is really important. And if you do have concerns, identify them for yourself first, like what are you concerned about? And approach it with her in a very, non-judgmental way by letting her know that you do have your concern for her safety, how much you love her, how much you care about her, and go through the list one at a time and see whether it's something that she might be concerned about as well, and negotiate and negotiate. I think as long as communication is open, you can achieve anything. But don't be afraid to approach it. Always in a positive way. Never make a person feel that they're not taking care of themselves necessarily. No blame and no shame.
We have
Sometimes it's
another.
good.
Oh, go ahead. I'm
Sorry.
sorry, Evelyn.
So sometimes it's good to own your own thing and just say it's been really uncomfortable for me, because I don't want to offend you, but I don't really feel like I can live with you. That's my problem. I know, whatever it takes, but to make them feel comfortable to, really think about it in a broader way.
And that's why I used the term woo earlier, because it takes a little bit of wooing. Sherilyn wrote in the chat box, my mom wants to age in place. What technology will help us keep an eye on her that is affordable, preferably without monthly service charges? It's an excellent question. We're going to talk a bit more about that later in our program today. Now, you can keep an eye on someone these days as literally as keeping an eye on someone and getting webcams put into a person's home, and you can have views on things. Many people do that to keep an eye on their pets when they're not in for the day. But you have to be respectful and considerate and cognizant of another person's privacy, feeling of willingness as well. So I'll be sharing some information about tracking tools that we can use on our phones, that we can also put on people's shoelaces and things like that, that are a little bit less invasive. But I do that with my husband, for example. I always like to know where he is in case of emergency. I do that with my dad, and I can find them on my phone at any time with my brother, his wife. So we'll talk more about that. And those don't have any monthly service charges. We received another comment from Kim. My brothers are power of attorney for finance. I'm power of attorney for health. I do all the work only for her. She's very advanced in Alzheimer's. And Sherilyn also said, just a word on services. If you're middle class, forget it. You don't qualify for anything. Well, that's where creativity comes in, especially for caregivers, and finding nonprofits and all kinds of programs in your community that can help to support you. Many people are feeling that pinch right now. And we talked last session about the catch-22 for Medicaid approval. Ashley shared the area agency on aging is your area is strictly for individuals 60 and older, and they have a family caregiver support program. Income is not accessed for most of the programs, as long as someone is caring for someone 60 or older who needs 2 or more activities of daily living, or a chronic progressive disorder like Alzheimer's or dementia, they will qualify for an individual. If someone receiving Medicaid services could be an issue, but it's important to know the Family Caregiver Support Program is a last resort supportive program. It's a great piece of advice for your local AAA. Kim is also asking on info on what does it really cost to take care of her. That's an excellent question, and I would have to refer you to that wonderful recording that Evelyn mentioned at the top of our hour. Last week, we actually broke down and had a slide on the specific costs associated with in-home care, long-term care, nursing home care, and that was provided by Regions Bank, who has different support services for helping people age. You can also find more information about the costs on the AARP website. But I do caution, a lot of these costs were estimated ahead of the pandemic. It's very hard to find cost information that is averaged in this rate of inflation that we're experiencing right now. So you might find that that information is more or less reflective of the community in which you're living. It is not something that I see as being equal across the board in the United States. So I would encourage you as well to reach out to your local AAA for specific information about costs too. Woof, I think I got through all the chats there.
Good job, Elliot.
I think there was one more popped up. No? Okay.
It was just a thank you.
Thank you and a thumbs up.
Yeah, we like those.
So-
Thank you.
So I'm going to move ahead because I want to make sure that I can get to the portion of our program where we talk about those technologies. And before I forget, I was recently at the American Society on Aging meeting, met a lot of interesting people and attended a lot of very interesting programs. One of them was from an organization called Boundary Care. I don't know much about it, but their focus is on tracking devices for people with Alzheimer's and dementia who wander. So, all right. I hope that this checklist was helpful for some people. Now, the area of focus for our program today is really how to make tough decisions. And one of them might be about having a loved one move in with you. And this is a difficult thing for a lot of caregivers. So if you decide to have someone move in with you and you're concerned, you're not alone. 1 out of every 4 caregivers, though, actually lives with the elderly or disabled loved one that he or she provides care for. And this arrangement can have many positives. If your parent or your loved one is still relatively healthy, for example, they might be able to babysit or help around the house, contribute financially, get to know your children in a way that might not have been possible with only occasional visits. We used to see this, we talked in our program a long time ago that families live together, and that stopped being the case many decades ago. It's not right for everyone, though. It certainly is a cheaper option than a nursing home or an assisted living facility, but you could pay a heavy price in terms of time, stress, fatigue, but most importantly, strained relationships. So we want to encourage you to think about some of these things. We put them on this slide and I'll go through them. What kind of care will the person need? Think about the person's mental and physical condition and what the chronic illness the person has. I think these are really the first questions that people need to answer, and look into those illnesses, do research, find out how they progress. You want to know what you can anticipate. If your loved ones are still relatively healthy and independent, it may be more ideal for you all to move in together at that point rather than when your loved one becomes sick, so that they can sort of adapt a bit better and you can enjoy one another as much as you can. The other question is, how much assistance and supervision will your loved one need, and how much can you provide? That might be linked to the progression of illness, but caring for an aging relative is certainly a wonderful way to give back some of the love, care, and nurturing that that person might have given you. Now, when you take care of someone, you provide also a model of care to those around you that shows caring and commitment. I think it also prepares children, for example, for a time when you might need care from them. And eventually, they might have seen your modeling of behavior. But I think it is really important to be realistic about what you can and cannot do, and realize that if the level of assistance that you'll need to provide increases over time, will that be feasible for you? And if it won't be, have a plan in place. Know your limits. If the person needs help with bathing, dressing, or going to the bathroom, are you comfortable with that? If they're incontinent and the idea of changing a diaper makes you uncomfortable, you need to really take stock of that, and maybe you need to find an in-home aid. I think another really important one is consider your schedule. Most people don't think about this. But if you have a full-time job and if you have a family at home, consider the impact of taking in someone who needs a lot of assistance. For example, if they need help going to the bathroom several times during the night, you might soon be suffering from major sleep deprivation. And that is a really, really important consideration. I know for me, if I don't get adequate sleep, I cannot care for myself or anyone else. The other thing to consider is, are you thinking about this in a reactionary way? You may be reacting to a health crisis or thinking about a move as a preventative measure as a person is slowly losing the ability to take care of him or herself. But in either case, think about whether you have the time and the energy, and also who's participating in the decision-making. Decision-making should also, as Lucy said, communication is key. So you need to communicate with anyone else living in your household and think about how that move might also impact them or how they might feel about it. Sometimes it creates strain with a spouse because you're dedicating more attention to the person for whom you're providing care. So it's important to think about all those dynamics that Lucy was talking about. One of them is certainly, how well do you get along? Look at the history of your relationship with your family member. If you enjoy one another's company and you can successfully resolve differences easily, that's amazing. Now, that doesn't mean that you can never argue or that you have to be best of friends, but there are other families that have a lot of conflict, and it might not be as easy for you to get over it so quickly. So you need to really think about that. If the two of you have never really gotten along, I don't think you should expect the relationship to magically change now. So it's important, to consider how you feel around that person. Sometimes doing the right thing doesn't mean doing the right thing for us individually, and it's important to really think about that. And certain diseases as well, like Alzheimer's and other forms of dementia, can change a person's personality. And that can be for the better or for the worse. Will you be able to handle what happens in an illness that progresses? The two of you may have always had a good relationship, but we have to also remember that dementia can make people angry or paranoid in ways that we might not have seen in their behavior before. On the other hand, it can make people much more calm. You just don't necessarily know. So these are things that you really need to think about, as well as certainly, is your home aging friendly? We've talked about this a lot, about home modifications. Sometimes they can be considerable in terms of cost as well. This is also very true during this housing market right now, where construction costs and materials are so inflated, labor is sky high. So I encourage people, if you are considering this and you haven't participated in our previous sessions this month, listen into the podcast, the recordings. These are all very important things to think about. For example, if a bathroom is on the floor, the main floor where the person's living, are the hallways wide enough to accommodate a wheelchair, for example? Would one of your children have to give up a bedroom? If there's no extra bedroom, how do you convert another room? So there are a lot of questions. There's a lot of resources we've provided and answers. In addition, a very good source for finding a variety of information is on the National Resource Center on Supportive Housing and Home Modification website. We'll be providing that link also with our resources today.
And if you don't mind, Elliot, having done so much in-home case management, I think maybe something you want to add to that list are the habits of the person, who would be moving in, because alcohol use, smoking, drug overuse, all of those things really impact how your relationship is going to go and how they're going to do in your household.
Absolutely. These are excellent points. Even sleeping patterns. If that person likes to sleep in and doesn't jive with the rest of the routine in your household, if you have kids that need to get up early for school, actually, these are points I had included in my presentation, but because we've had such rich participation today, I sort of went through it a little bit faster. But Evelyn, you make an excellent point.
Oh, thank you.
Yeah, just to give you an example, I wanted to have my mother live with us, and we got a home that would accommodate her. But my mother was a pack smoker of cigarettes, and my young daughter, I can't tolerate the smoke, and my young daughter had asthma. So, these are really important things to consider. It broke my heart, but we make choices. I know that we have a lot of information. I am looking at the time, Elliot. Should we go to the next question, or do you want to elaborate more on a part of the other part that we want to discuss today? What would
On the technology piece related to the question, was that what you meant?
Well, the next question is very interesting because it really follows. I'll go through it quickly.
Okay.
On slide 7. Okay, I'm an 82-year-old man, and during the pandemic, moved into the basement of my youngest daughter's home. She and her husband have a beautiful, large home, and the basement has a full apartment. I love her children, and it seemed like a good idea to move in with them. I appreciate everything they do for me and everything my daughter does to make me feel comfortable. But I'm in a terrible spot. My daughter and her husband fight constantly, as do their children. It's been terrible on me. I don't want to get involved, but I'm living in their house. When my daughter is put down or disrespected, I had to open my mouth. Now I've created a very tense and uncomfortable environment, and I don't want to continue living here. I'm not sure how to discuss this with my daughter, and I'm not sure where to move now that I've sold my condo. Do you have any suggestions? And believe it or not, a lot of people, that get into these situations and don't know how to get out of them, because all those questions were not asked before, or all the things that we were looking at that Elliot was talking about. So I do want to thank you for your question, and I can understand how you feel under these circumstances. So, it's really important for you to first speak with your daughter. Be honest and tell her about your feelings in an open, constructive manner. First, let her know that you appreciate all that she does to make you feel comfortable and how much you love her and the rest of the family. You also need to let her know, since you are her father, how it made you feel when the family fights constantly, especially when she's put down or disrespected. Tell her you regret opening your mouth, but it was unavoidable for you. She needs to understand, you are her parent. Let her know that the tension in the home is hard for you to handle, and it might be best for you to move. Ask her if it would be beneficial to have a family discussion to identify issues and find solutions, to express feelings, to express them and not put any blame. I really feel that it will be up to her to make this decision if she feels that having a family discussion and getting together would be helpful. If you do decide to move, I would suggest that you consider counseling so that you can make the right decision for yourself. Let her know that you are there for her and the family, regardless if you stay or if you move out. Let her know that you are, that you love her, that you love the family, but you want to respect their privacy as well. So, conflict resolution skills. I mean, this is what we talk about. Really, we have to learn to talk. And again, it depends on your family dynamics, how you talked with your family before, how open you are. There's mediation. There has to be empathy. You have to understand. So maybe, daughter didn't ask her husband prior to you moving in how he felt about it, but it's never too late. I think as long as you're open to communicate, as long as you're there to be, not to blame or not to shame anyone, but to be honest with yourself and listen to what your daughter has to say.
Those are all excellent points. And in the interest of time, I'm going to move ahead because I did want to talk about some important technology. And as I mentioned, I was at the American Society on Aging meeting, and I was fortunate to attend some presentations that I think were very relevant to many of the questions we received. One of which is that many caregivers are concerned about loved ones wandering or getting lost, or even being out and falling and having an accident. So we've talked before about technologies like Siri and Alexa and how they could be helpful to dispatch help, for example, if you fall. Well, smartwatches and other tracking devices are also being used now to help track people who wander. So if a person is wearing a smartwatch, as an example, this doesn't carry any kind of a cost to it, unless you have a cell phone plan attached to that watch, for example, then you can track that person. Another new device these are called tiles. You can find them rather inexpensive at Walmart, Target, on Amazon, and you can attach it to a keychain, for example, for people who lose their keys a lot. And on your phone, you download an app and you can have it beep or make a noise or have a light go off. There are lots of new technologies. And surprisingly, your local Best Buy store is a really good source of information for all of these webcam things that I was talking about and these tiles. And if you need things installed, like those webcams, they can take care of it as well. Now, if you do have a loved one who has Alzheimer's or related dementia, I can't underscore enough how important it is to plan. Now, consider enrolling in a nationwide emergency response service that facilitates the safe return of individuals living with Alzheimer's or related dementia who wander or who might have a medical emergency. There are some really good tips that we have here on how to help people to stay in the home and to stop them from wandering. Placing deadbolts, for example, outside of the direct line of vision is a very good tip. You can install a latch, for example, either high or low or on exterior doors. Cover doorknobs with the same color. A cloth, for example, if you have a white cloth and your door is white, cover the handle with a white cloth. It makes it less conspicuous. Camouflage doors by painting them the same color as walls or covering them with removable curtains. That's a really clever idea because you can very easily put up a bar and a curtain to camouflage the door. Some other tips that were really good ones is installing warning bells above a door or using a monitoring service if you want to sign up for one that will be triggered if a door opens. There are many home monitoring services, again, that don't have a monthly fee attached to them that you can buy and install yourself, but from Amazon, Walmart, Costco, but again, Best Buy can take care of those things. There's planning and there's important resources and tools on the Alzheimer's Association website here on your screen. Really, the stress experienced by families and caregivers when a person living with dementia wanders is significant. And it's important to have a plan in place beforehand also so that you know what to do in case of emergency. And the main tips for that one are to have a recent photo of that person readily available on your phone, for example. Ask neighbors, friends, or family that if they see the person wandering or dressed inappropriately, for example, outside of the home, to reach out to you. You definitely want to consider enrolling that person in one of those wandering services that I mentioned. And another really smart tip is to create a list of places that the person might wander to. I have a student, a grad student, whose parent has dementia and had recently wandered off and they couldn't find him. And he had gone to his old job. He reported for work, and that's a very common one. So keep a list of addresses of former jobs, houses where you might have lived, places of worship, if that's part of a person's normal routine, or even a favorite restaurant. And the resources that we have here that I've provided have amazing tips and tools, and we'll be sharing, of course, all our slides with our registered participants.
And if they live alone, they want to have a alert bracelet on or a necklace so that they can call emergency, right?
Yes and no. That's the old-fashioned, device that many of us are accustomed to. But if you have a listening device in the home, like an Alexa, for example, and if it's connected to what's called an Amazon Echo, I know it's a lot of technology. That's why I'm saying go to your Best Buy store, and they have people there who are teenagers and in their 20s and who can help you with everything. But it's true. And with these devices like Alexa, you can just say, I need help if you need it. Same with Siri on iPhones, and smartphones of all manufacturers and brands have similar types of technologies nowadays. So you don't need to have a lanyard around your neck. In fact, I feel concerned sometimes that could be a choking hazard. So we have all of this hands-free technology that we should be thinking about and making use of as we plan.
Thank you.
So are there any questions or any comments or any suggestions that the rest of you have to share with others?
Just unmute your phones by pressing *6, or you can unmute yourself on Zoom.
We have had such amazing participation today.
I know, it's been fabulous.
An honor and a privilege, and I thank everyone for sharing. We learn from everyone's experiences.
It's so true. And Elliot, did you see any new medical long distance kind of monitoring devices when you were at the Society on Aging?
So just that one organization called Boundary Care that I mentioned, but I'm not overly familiar. They were in the exhibit hall. But I think the main point, though, is that we can now, with these devices like tiles, which are really inexpensive, and you can put them on a person's shoe, you can track where that tile is in your community, neighborhood. People do it with pets on collars, for example. So to me, I like to know if I'm worried about my father and I've called him and he's not picking up, I can look on my phone and go to the Find My Person app, and I can pinpoint exactly where he is in his apartment building or wherever. It's a wonderful tool and feature to have. If you do have an iPhone, you can go to your local Apple store or call their customer support line, and they can walk you through all of the steps of how to set that up.
I know a family who was thinking about moving their loved one into their house, and instead they opted to expand the amount of kind of medical supervision that their loved one was getting by installing things like a scale that went to their doctor's office because they had congestive heart failure, putting in, some other kinds of equipment to see, different things, blood pressure cuff that went to the doctor's office. So, things that can be done medically to help someone stay in their own home a little bit longer.
100%. And we're seeing an evolution of those kinds of technologies, everything from glucose meters that gets reported and recorded, as you said, blood pressure monitoring. The next iteration of the Apple Watch is supposed to have an EKG built into it that can detect arrhythmia or irregular heartbeat. So these technologies, I think we're seeing them mushroom. And what's interesting is that they're not necessarily coming from medical companies. They're coming from innovation and technology companies because of consumer demand for things like this to help people age in place longer. So that's why these type of our sessions, we're always trying to keep up on the latest and newest technologies because they're very critical right now to helping people continue to age in place, and the technologies are evolving at a speed that's hard to keep up with.
For sure. Okay, if you don't mind, I'm going to do a little bit of housekeeping here. If we have time at the end, we can take another question. I want everyone to know that all the information that you received today and the resources will be included with your post-session questionnaire, and that will be sent to you very soon. If you're registered, if you're not registered, please call WellMed Charitable Foundation Customer Service 866-390-6491. And with that, you will also get the monthly calendar, and we have a bunch of really good new ones next month. I know Lucy's talking about delirium, which many people find confusing with other things that happen. We also have how the pandemic impacted caregivers' mental health, which is huge right now. And that's both with Dr. Sklar and our dear Lucy. The ABCs of Alzheimer's with Tam Cummings, who is just, a fabulous speaker and knows so much about all the different kinds of dementia. The federal, state, and local services, I know someone asked about that. That would be Thursday, May 5th. And that's with, both for people who are 60 plus and for their family and informal caregivers. And then Dear Lucy's also going to talk about with Elliot, caring for someone with mental health issues. And we have one on frontotemporal degeneration. What is it? What are the signs and symptoms? With Sharon Hall, who's done it before. It's been very popular because it's a tricky diagnosis and tricky behavior problems. We're also going to have online with us all our superpowers that we underestimate, but can get us through many challenges. You're stronger than you think with Dr. Jamie Heisman. And he's a great presenter, very entertaining. And we hope that you will join us for all of those or some of them. And I want to thank our expert speakers today for a beautiful job. As always, the research, the information that they give us, the way they answer questions, on the fly. They've just done such a beautiful job. I want to thank all of our participants for, being there with us and giving us so much information and for what you do. I also want to thank the WellMed Charitable Foundation for supporting caregivers and clinics and the community and the website and all these teleconnection sessions. And with that, I am afraid it is the top of the hour. So I am going to stop the recording, but I really want to appreciate all of you and thank you so much for what you've done. Elliot, Lucy, another beautiful job.
Thank you so much. I just wanted to quickly respond to Sherilyn's question about a video service that doesn't charge monthly service charges. You can find any kind of a camera, a webcam, a video cam on Amazon or at Walmart. There are multitudes of brands. They start at about $20 and they have apps that you can download on your phone to watch remotely. But I also mentioned Alexa and Amazon Alexa Echo, I believe it is. If you go to your Best Buy store and ask them, you can actually then have a screen where you can video chat with your loved one in addition to being able to monitor them. So please visit your local Best Buy store because they have the newest, latest, greatest technologies and a lot of talented, helpful people who can help.
Okay, Elliot, do you have a disclaimer for investment in Best Buy?
Not at all. I'm not saying to buy anything there necessarily, but I go there to do a lot of research because if you don't know what you're looking for, it makes it hard to look for on Amazon.
I was kidding.
No, I know, but it's a great point that you bring up. But the thing is, you don't know about these technologies unless you actually see them in a store sometimes. So it's good to go and actually go to the place that has the most variety.
Thank you so much. I love the way you do research. It's everywhere. Okay, everyone. Thank you so much. We really appreciate you being with us today.
Thanks so much. Have a great day.
Thank
Bye,
you.
everybody.